What is heel pain? Causes treatment prevented. In conclusion, heel pain is a common issue that can result from various causes, such as plantar fasciitis, Achilles tendonitis, or heel spurs. It can affect daily activities and mobility. Now, watch the video to learn more about the causes, treatment options, and prevention tips for heel pain. Heel pain, also known as plantar fasciitis or Achilles tendonitis, is a common foot condition characterized by discomfort and pain in the heel area. It can significantly impact an individual's mobility and quality of life. The pain is typically worse in the morning and can vary in intensity depending on the underlying cause. Here is an overview of heel pain, including its causes, treatment options, prevention, and a conclusion. Causes. Plantar fasciitis. This is the most common cause of heel pain. It occurs when the plantar fascia, a band of tissue that connects the heel bone to the toes, becomes inflamed due to excessive stress and strain. This often happens as a result of overuse, improper footwear, or biomechanical issues. Achilles tendonitis, pain in the back of the heel, is often attributed to inflammation of the Achilles tendon. It's typically caused by overuse or improper footwear. This condition can lead to discomfort and limited mobility. Heel spurs. Heel spurs are bony growths that can form on the underside of the heel bone. They may develop due to long-term inflammation or tension in the plantar fascia. Other causes. Heel pain can also be caused by factors such as stress fractures, bursitis, nerve entrapment, or systemic conditions like arthritis. Treatment. The approach to treating heel pain depends on its underlying cause. Common treatment options include rest, reducing or modifying activities that exacerbate the pain is often the first step in healing. Applying ice to the affected area can help reduce inflammation and provide pain relief. Stretching exercises, stretching the calf muscles, Achilles tendon, and plantar fascia can help improve flexibility and reduce strain. Footwear. Wearing supportive, well-fitted shoes with cushioning insoles can alleviate heel pain. Orthotics, custom or over-the-counter orthotic insoles, can provide additional arch support and reduce strain on the plantar fascia. Physical therapy. A physical therapist can recommend specific exercises and stretches to address the root cause of the pain. Medications. In some cases, anti-inflammatory medications or corticosteroid injections may be prescribed to reduce pain and inflammation. Shockwave therapy. This non-invasive treatment uses sound waves to stimulate healing in the affected area. Surgery. In severe cases, when conservative treatments fail, surgery may be considered, but it's typically a last resort. Prevention. To prevent heel pain, consider the following measures. Proper footwear. Invest in supportive shoes that fit well and provide adequate cushioning. Stretching. Incorporate daily stretching exercises for the calf muscles and Achilles tendon into your routine. Gradual progression. If you're starting a new exercise regimen, gradually increase intensity and duration to avoid overuse. Maintain a healthy weight. Extra body weight can place additional strain on the feet, leading to heel pain. Orthotics. Consider using orthotic insoles or inserts to provide additional support. Avoid prolonged standing or walking. If possible, limit prolonged periods of standing or walking on hard surfaces. Conclusion: heel pain can be a frustrating and debilitating issue, but with the right care, it's often manageable. The key is identifying the root cause, whether it's plantar fasciitis, Achilles tendonitis, or another condition, so you can get the proper treatment. If your heel pain persists or worsens, don't hesitate to consult a healthcare professional or podiatrist for personalized advice. In the meantime, simple steps like proper footwear, stretching, and rest can make a big difference. Thanks for watching. If this video helped you, please like, share, and subscribe for more health tips. Here's to happy, pain-free steps ahead.